You know, when you've had a movie made of your life that's really simple and the guy's a foot shorter, it may not say everything. Okay? This is me. I entered medical school in '67 as a political activist. I am first a political activist. Medicine and clowning are two of my styles, okay? But I'm here to end market capitalism, the thing that if we don't change will make us extinct this century. Hear that from a doctor. I am not pessimistic. I'm reporting you the medical truth. I'm one of those students who didn't have to study, okay? Everything was easy. So I spent my time studying healthcare delivery systems with the idea to create a hospital model addressing every problem of the way healthcare is delivered in one model, because as you can see from the last healthcare discussion, no one had any ideas. And so this was a hospital we started in 1971, okay, that doesn't charge money. In fact, we wanted to eliminate the idea of debt. We never wanted to have anyone think they owed something when they got care. We wanted them excited they belonged something called community. That if we're really going to help each other, it's going to be that we resurrect the we and not march around, I. We're free. I've been a free doctor for 40 years, okay? And also, I've never taken health insurance because they try to control the way health care is delivered. The traditional 7.8 minute with a doctor, that is not medicine. You can be great in 7.8 minutes, but that is not the practice of medicine. My initial interview with a patient is 4 hours long, and it's unbelievably intense 4 hours. My ideal patient is somebody who wants a deep, intimate friendship with me for life. That is who I am as a family doctor. In spending 4 hours with a patient, I found 3% of the people I talked to had self-esteem. So almost no one loved themselves. I love me! You know, if you want to be a revolution, start by really loving yourself. It'll be a lot easier to be a revolution because then you'll want to put yourself to good use if you do love yourself. I found less than 5% had any idea what a day-to-day vitality for life was about. So, in actual, the normal adult was, they didn't love themselves, they didn't love their marriage, and they didn't love their work. And that wasn't what they were coming to a doctor for. And we just happened to decide we never disliked the patient enough to give psychiatric medicine. We were interested in mental health. And so we ran this pilot for 12 years. No one gave us a hospital, so 20 adults, 3 of us doctors moved into a large 6-bedroom house and called ourselves a hospital. We were open 24 hours a day, 7 days a week, for all manner of medical problems from birth to death. We had 500 to 1,000 people in our home each month, with 5 to 50 overnight guests a night. In the 12 years, 15,000 people came to our home, 3,000 had profound mental illness, and we never gave medicine for it. We loved our patient. My record hug is 12 hours. I'm good at 12 hours in a hug. Okay, so this is just a hint, okay? I can tell you this, I thought it was gonna be a funded hospital in 4 years. When we started in 71, I thought it'd be open in 75. In the 41st year, this June, I started building our first big building, so I'm on a psychotic break. We are building, okay? We are building a hospital that eliminates 90% of the cost, and to eliminate hierarchy so that there are no more arrogant pricks running them, that at our hospital, the cleaning person and the surgeon make the same salary, $300 a month. And they're able to do that because the full-time staff lives on the ground at a hospital as a communal eco-village, so that we can see that it was a really stupid mistake to invent the nuclear family. We are communal animals, and that we can have great vision as groups. Nuclear family is a failed institution. There's no point in striving for it. Strive for collective love. It just takes getting together, like they're doing here in this beautiful experiment. Getting together collectively, we can do it. I love this 99% thing, you know. It just means that there aren't any enemies. The Tea Party isn't an enemy. Nobody is an enemy. You know, that the point is, you know, I'll tell you the truth. Because of the film, I make $20,000 on a lecture. Okay, I give it all away. I don't own anything. I give it to our project. So it actually doesn't matter if you make $1 million a year if you give it away. Okay, the money is not the problem. In the world of the I, you think it's for you to buy a gold watch or to get some second house or third yacht. You know, the only reason to have fame or power or more money than you need for your family's survival is to use it to help save humanity and the few species that'll be left on the planet. Okay? We need a love revolution. Okay? For example, no medical school in the world teaches compassion. What the hell is going wrong? Loving is the most important thing in life. How weird is it that not a single public school in the world teaches 1 hour in 13 years on the intelligence of loving? And how capitalism tricked us was they said, loving is a feeling. And yes, love has feelings, but if you're good at loving, it's an intelligence. And if you need to know what I'm talking about, watch A Healthy Mother. That's the intelligence of loving. And loving, if it were taught like mathematics, which may not be the most important thing in life, 1 hour a day, 5 days a week for 13 years, imagine how different we would be as a people if love as an intelligence was taught in school 1 hour a day, 5 days a week, K through 12. It would be a different world. Because let me tell you, okay, loving is the most important thing in life, and in those 4-hour interviews with patients, of course I'm going to ask them their relationship to the most important thing in life. If we are thinking animals, which is a presumption, if we were thinking animals, we would spend a lot of time thinking about the most important thing in life. We would have a well thought out philosophy of loving ourselves, of loving our friends, our family, our gods, our nature, our arts. We would have an intellectual, thoughtful relationship to love. We would have a philosophy of loving and a plan to carry it out. And in 45 years of interviewing thousands upon thousands of 4-hour interviews with people, nobody ever had one. So we don't think about the most important thing in life. We don't teach the most important thing in life. And I've never found a group of people who spent the evening in a thoughtful, intelligent discussion on loving. So we don't talk about it either. So I'm here to say, if we want to change the world, we need a love revolution. And that's why we took the most expensive thing in America and gave it away for free. And that it's in our home. And that when our hospital reopens, I'll stay up all night with you. It'll be free. I'll do it for my pleasure. Because my high is in loving. If you like the image of a composer, maybe Mahler, you can choose every note of your life. But one option, instead of living from a because syntax, which is where most people live, because of what happened to me, because of my age, race, gender, economic status, and disease, we are becausing ourselves to death. One option, just an option, is for you to decide that you will be a loving human being, so loving you will scare people. You're so loving. They'll have a hard time being around you because they'll start really liking it. In fact, anyone can do it. It's just a damn decision.